Hello class, this is Waad Ali, your instructor for the Critical Care Nursing course. Your next class will be on acute renal failure. We will go through the acute renal failure definition, causes, signs, symptoms, diagnosis, treatment, nursing care plan, prevention, and patient education. Acute renal failure, which is also known as acute kidney injury, is a common problem in intensive care. Acute renal failure affects about 5% of hospitalized individuals and has a mortality of 50 to 80%. Acute renal failure develops rapidly over a few hours or a few days. Acute renal failure is most common in people who are already hospitalized, particularly in critical ill patients who need intensive care. Therefore, it is important to understand what is acute renal failure and what are the nurse rules in the patient's management plan. When you understand the concept of acute renal failure, you will be well prepared to provide safe and high quality care when you enter the practice setting. Now, before we go to the definition of the acute renal failure, let's review the normal function of the kidneys to help you understand the pathophysiology of the disease. So, kidney function, normally, blood enters the kidney through the renal arteries. The kidneys remove excessive fluid and waste materials from the blood through units called nephrons. Each nephron contains a filter, glomerulus, that has a network of tiny blood vessels called capillaries. The glomeruli filter waste products and substances that the body needs, such as sodium, phosphorus, and potassium, which then pass through tiny tubules. The substances that the body needs are reabsorbed into the bloodstream. The waste products flow through the ureters, the tubes that lead to the bladder. So when the kidneys suddenly become unable to filter waste products from the blood, acute renal failure occurs. And when the kidneys lose their filtering ability, dangerous level of waste may accumulate and the blood chemical makeup may get out of balance. Acute renal failure defined as any sudden fall in glomerular filtration rate that is sufficient to cause uremia. The nurse has an important role in caring for the patient with acute renal failure. The nurse monitors for complication, participates in emergency treatment of a fluid and electrolyte imbalance, assists the patient's progress and response to treatment, and provides physical and emotional support. In addition, the nurse keeps the family members informed about the patient's condition, helps them understand the treatment, and provides psychological support. Therefore, it is important to understand that the acute renal failure to provide safe and high quality care that not only meets the patient's needs and values, but it also meets the family members' needs and values. So class, that was an overview of acute renal failure to give you a general idea about what we will be covering in the next class. In the class, we will cover the symptoms, causes, risk factors, complications, test and diagnosis, treatment and drug, nursing care plan, prevention, and patient education. We will have a case study to go through and other activities for you to help you learn and understand this clinical concern, acute renal failure. Also, we will have a simulation scenario to help you connect what you have learned in class to practice. and to practice and acquire the clinical skills in a safe environment. So, come to class prepare to discuss acute renal failure and see you in class.